The rule is straightforward, fair, and effective. It simply requires that families choosing not to vaccinate first receive information on the personal and public health informations of that choice, a choice that they're still free to make. Michigan is only one of 20 states that allows non-medical vaccination waivers for philosophical or personal reasons, and these waivers account for 71% of all waivers in the state, and they are the reason that Michigan has had more unvaccinated children than all other states except 3 in the United States. The rule went into effect last year, helped Michigan make progress in its vaccination rates. Unfortunately, last December we saw the introduction of House Bills 5126 and 5127, legislation that would undo the state's progress by attacking this common sense reform. These are dangerous bills that undermine the medical and scientific communities. What's worse is its tremendous potential harm to children. Vaccinations protect children from dangerous diseases. When a critical portion of the community is immunized against a contagious disease, then most members of the community are protected because there's little opportunity for an outbreak. So due to a high waiver rate, there are many schools in our state that have fallen below a critical vaccination rate. And when those vaccination rates dip, we easily see outbreaks of diseases like we saw in 2014 with measles across the country. We want parents who opt not to vaccinate to know the gravity of their decision not to vaccinate. Vaccines are some of the safest medical products available, and they are effective. Parents who opt out of vaccination for non-medical reasons need information, and House Bills 5126 and 5027 are a threat to progress we've made in Michigan over the past year. They're bad for public health, and they're bad for children. I'd like to now introduce Dr. R. Scott Taylor and Dr. Mary Sharpe, who can speak more directly to the reason for this drop in the importance of immunizations. So thank you.
Wonderful. Thank you. Well, I'm Taylor Scott. I'm a family physician here in the Lansing area, and I'm so pleased to be here at the Ingham County Health Department representing osteopathic physicians, talking a little bit about the ups and downs of last year. The downs are the waiver rates. It's wonderful to have those go down, because what that means is the ups, and the ups are in the immunization rates. So there's nothing more that we're more proud of and is more important for the children of Michigan than to get immunized. The best reason to get immunization for everyone is actually because you can. There are significant diseases that are caused and that can be prevented by immunizations, and simply having the ability to get an immunization is wonderful. And there are places in the world where immunizations aren't possible, so we're quite privileged in Michigan. This means healthier kids for the state of Michigan. School-age children are especially vulnerable. They're in large groups. We intend it that way. And there are lots of communicable diseases that are carried in large groups, not only in colleges and elementary schools and middle schools and high schools. But it's wonderful to have the opportunity to be able to immunize children. They're quite a vulnerable population. That being said, getting immunizations affects not only school-age children, but also families. So children, we're all familiar with coughs and common colds and bringing stuff back home. So it's not just for the children of Michigan, it's actually for all citizens of Michigan that immunization is so important. With that, I'll summarize in really the reason to get immunizations, and the reason we're so proud is because we can get immunizations and recommended for everyone. So at this point, I'll turn things over to Dr. Mary Sharpe, and she has a couple of comments as well. Dr. Sharpe.
Michigan, unfortunately, is getting a reminder of what happens when good public health does not occur in the state. And of course, I'm referring to the water situation in Flint with that. But even quieter than the assumption of good quality water coming out of your tap, quieter behind that is the assumption that we have a population of people who do not carry profound, dangerous, infectious disease. There has been a lot of confusion about immunization, the science of immunization, the science of public health, the science of water quality and pollutants is confusing. It is challenging for the most educated of us. So how can a family member determine what's right and what's wrong? it has become very common for families to think that immunizations are not a big deal, but they still are. We're going to hear from some parents who understand exactly how important they are. A lot of the misinformation about immunizations came out of the autism community. That has been a big, smoldering, volatile conversation that really has quieted down because the suspicions and concerns that were raised at that time had been found untrue. The science that suggested this was done in an unethical way. So this is something that should no longer be in the back of people's minds, that these immunizations cause autism. So I'd like you to hear from a mother now about why immunizations are so vital to her child.
Thank you, Dr. Sharpe. Good morning. My name is Monica Bachmann. I live in Okemos with my husband and 2 young sons. Our son Luke had stage 4 rhabdomyosarcoma cancer when he was 3 years old. As a result of the chemotherapy that wiped out his immune system, all of his previous immunity was gone, and he had to be on a delayed vaccination schedule until he was completely healthy, which was 2.5 years later. While he was immunocompromised, he had a 104.8-degree fever due to a bacterial infection, and honestly, that could have gone either way. He was already fighting a deadly disease, and the thought that he could have contracted something preventable, like measles, mumps, or whooping cough, is incredibly scary to us as his parents. Thankfully, the science worked for Luke, and he is a healthy 10-year-old in 4th grade. Kids like Luke can't get immunized, which means it's incredibly important that those around him do get immunized and are properly vaccinated. Vaccinations protect children and communities. Today's new numbers are great news for families like mine and for children like our son Luke. They mean that thousands fewer children are at risk of contracting diseases that are completely preventable. Now's not the time to undo the reforms that have helped create this kind of progress. Please think about Luke and other kids like him. Thank you.
Thank you, Monica. My name is Patricia Gunner, and I'm pleased to be representing the Michigan Association of School Nurses. I was a school nurse for 26 years in Ingham County. School nurses work hard every day to protect the health and safety of children. Immunizations couldn't be more important to protect their health and prevent disease. They're safe, they're effective, and critical for the well-being of the children receiving the immunization, as well as the children that, like Monica was saying, that can't receive immunizations because of medical conditions, and also the younger siblings of the children receiving immunizations. Lawmakers should be encouraged about the success Michigan is having in keeping our children safe from vaccine-preventable diseases and not looking backwards to those high waiver rates. Michigan's recent immunization waiver reforms have made a real difference for thousands of children across the state. And House Bills 5126 and 5127 threaten that progress. We hope that Lansing will reject House Bill 5126 and 5127. With that, we'd be happy to take questions.